The new year should be a time for new beginnings, for hope and optimism. But I suspect that with the financial crisis in the NHS and with the uncertainty that a general election brings, then there's going to be quite a degree of apprehension too. And it's with this in mind that I want to look forward to the challenges of representing you in 2010. And there certainly will be challenges. But despite these challenges, the BMA will continue to listen to you, our members, and to support and to speak up for you. To kick off the new year, the BMA will be taking its Look After Our NHS campaign to the general public. As you know, we've been speaking out for some time against the government market-based reforms in England, the problems they're causing for patients, and the waste and inefficiency of things like the Private Financial Initiative, payment by results, and ISTCs. We'll be asking you to spread our message out to the public and to try and help them to convince politicians that they need to change their policies. This government, and any potential future government, has already made great play of how there are going to have to be savings made in the NHS and in public spending in general. The BMA will be fighting unnecessary cuts to frontline services and certainly too fighting to protect your jobs, your pay and your pensions. We want to see the government get rid of the waste in the system that comes through the bureaucracy of the market, the amount of money they spend on private management consultants and expensive initiatives like the Private Financial Initiative. We believe that by getting rid of these areas of waste, we can protect money for frontline services and protect money for doctors and patients. Early in 2010, of course, we'll see a general election, which may well mean a change in government. The BMA has already produced its manifesto for the election, in which we talk about how to make the NHS sustainable in the longer term, how to protect the workforce, and about the important public health issues that we'd like to see introduced. In terms of the workforce, I've already talked about jobs, pensions and pay, but we also want to protect education and training, which is often the first victim when the money gets tight. In public health, we want more work done on smoking, but also on alcohol, obesity and climate change. And that last one people might think is a little odd, but that's actually quite a big threat to the population, not just of the UK, but the wider world. Another uncertainty that we'll face during 2010 is the progress of revalidation. It's still unclear exactly what that process is going to mean for doctors and when it will be implemented. But we're determined that whatever happens, it must be fair, it must be proportionate, it must allow doctors to get on with their main work of looking after patients, and it must be properly resourced, both in terms of the money needed to undertake revalidation, but also to give any remedial training that might be necessary. You can be assured that, as we always do during 2010, the BMA's primary focus will be to stand up for doctors. That's what the BMA is about. It's your union, and it's important that you tell us what you want and we deliver on your behalf. I do wish you a very happy and hopefully a prosperous 2010. Thank you.